This segment describes the arterial access portion of the procedure. We either use the radial artery, the artery of the wrist, or the femoral artery, our artery in the groin. It is when we obtain access in these arteries that we advance a wire through the artery in the arm or through the artery in the leg and advance then our catheter into the heart to take the pictures of the arteries. Here we're going to demonstrate a radial access procedure, an access procedure in the wrist. You will be brought into the catheterization laboratory where the technician will place sterile drapes on you. He will then wash your arm with clear, cold cleaning solution and apply the sterile drapes in the area that we will be using. You will be hooked up to pressure monitoring and EKG monitoring so we can watch your heart rate and blood pressure. Local anesthesia will be applied to your skin, and then we will use a very small needle to access the artery, in this case, in your wrist. Once we feel the artery, we insert the needle and once in the correct position, we will then insert a very thin wire through the needle into the arm. An arterial sheath is then inserted into the wrist artery. You may feel a small amount of pressure during this portion of the procedure. We then administer medication through the sheath to avoid any spasm in the artery. This helps avoid any discomfort during the procedure. It is through this sheath that we will advance a catheter and direct it under X-ray guidance to your heart arteries. When we use X-rays, the lights may dim in the laboratory while we find the correct position for these catheters. Here's an example of a femoral arterial access procedure. The doctor will feel the area to help identify where your pulse is and use X-ray guidance and ultrasound guidance to find your blood vessels. Here, we see that the blood vessel is located in the correct position near the hip joint. In addition, your physician may use ultrasound guidance to also find the artery. Local anesthesia is administered to the skin, and the needle is inserted into the artery. A wire is inserted into the needle, and then a sheath is placed over that wire. Again, X-rays are used to identify the correct position for the catheters so that the pictures may be taken of your heart.